Hey everybody, welcome back to the Dr. Terri Show. We are in Puerto Rico at the beautiful Condado Vanderbilt Hotel. I've been here all week with just some brilliant doctors. Been on a couple of different shows, educating the public, and it has been such a great time. Today, we're going to be talking about hormones with 3 gynecologists that are local, and they are just brilliant women. We're going to dispel myths and misconceptions about hormones. We're going to answer questions. Do they cause cancer? Is testosterone for women? Do they cause heart attacks, strokes? All of these myths around hormones. What age is good to start hormones? Everything that is creating fear, I guess, in people. We're going to dispel all of those myths. So please join me with Dr. Celia Mendez, Dr. Sheila Ashby, and Dr. Maria Bonin. And you can read their bios and link to their websites in the description of the show. But join us in this conversation. It's going to be a lot of fun. Ladies, I want to, because I've already introduced you, but I want people to put a face to their names. So this is Dr. Bonin, Dr. Mendez, Dr. Ashby. Yes. Welcome. Brilliant physicians, change agents. You guys are early adopters for so many things here on the island. But I've spent a few days with you guys and have had so much fun. And I think that's one of the things I realize about everyone here in Puerto Rico is you like to have fun. Yes. You like to live life, and it's been really energizing, exciting for me. Okay, so let's talk about what we're here to talk about, which is really hormones. You're all 3 OB-GYNs, but just gynecology now. The OB is done. Right. Congratulations, I know. But, you know, about a decade ago, I think all 3 of you decided to bring hormone therapy to the island. So just... I want to hear from each of you, but what prompted the decision and just...
Yeah, we were in our office trying to fix some problems that with traditional medicine, we weren't able.
Like what?
Like low libido, which is one of the biggest concerns for women.
Absolutely.
And the traditional medicine doesn't help with that. So we were trying to figure out how to help our patients, because that's the point of medicine, right?
Right.
And we went to this conference that was talking about hormones, testosterone, and whatnot. And then we had a lunch with the pellets. So we learned about bioidentical hormones and about pellets. Also.
Which really isn't taught in your traditional medical training, right? Yeah.
It is not. And it's very controversial. I'm sure in the U.S. it's the same.
Yes, it is. Primarily because there's just no FDA approved testosterone for women. Talk, what about you? How did you get interested?
More or less the same, but then this is my own experience,
Right.
Time, like 8 years ago, I was passing through changes. Not the especially hot flashes and things like that, but tiredness. Like I'm just low self-esteem.
Yes.
But more tired than everything. And I just trying to think that my OB part was part of it.
Right.
And surgeries were part of it. So when I just choose to stop the traditional medicine, the things that, like I always use and always prescribe to my patients, didn't help me at all.
So it was a personal.
I said, I'm taking this and I don't feel anything at all. I'm still tired.
Right.
Maybe 1 or 2 flashes are gone, but that was not my main concern. Right. It was my energy, my
vitality, right?
Yes.
Yeah.
Yes. So was one of my patients that tell me, there are this new medicine here. And I just said, oh my God, no, this is not FDA approved.
Yeah.
We're going to talk about that. Better get out of it until, like I said, I start my own trip to the symptoms. So I went to the conference and I just get excited about trying this new hormones. And I had it to myself, they tell me. So after more or less 4 to 5 days, I just started sleeping better, like in 2 weeks. Like every time I wake up, I was so tired and all my bones hurt.
Yeah.
So that day that I wake up, I went to the bathroom directly. I said, oh my God, I don't feel pain.
Oh my
God, I don't want to move. Things like that. So
bring your mic up just a little bit. Yep.
Yeah.
It keeps dropping, but that's so it was a personal journey for you. It sounds like also. And then, Dr. Bonin, I've heard you talk about just how important for women we have multiple roles, and I believe I recall that's a real passion for you is helping women in this way. Talk about your journey and what was interesting to you, what you felt like was missing with your patients.
Well, I've always loved hormones as a gynecologist. I've never been afraid of hormones. I think many gynecologists are scared of them. She just don't want to deal with them. They just don't want to deal with those symptoms.
Right.
They're afraid of them getting clots or getting side effects, and then they just don't want to go there. Before doing bioidentical hormones, I was a fan of hormones. Whatever I had available at that time or at that time, I used and I prescribed my patients. But it was contraindicated for some patients.
Right.
Because sometimes you have a 60-year-old with hypertension or a history of a DVT.
Or at least that's what we were taught.
Yes.
At that time.
Right.
At that time, I was like, there's need to be something else. How am I going to treat these women? Because they all need hormones. This cannot be something that I can use for some of that.
Sure.
Not for other patients, because we all need it. Dr. Ashby and I we're all blood partners out of office, and we always used to joke like we need to find something because we're working women, mothers. We love to exercise, and we have strong personalities, even with PMS.
Right. Yeah. Even stronger.
But also, we need to do something or we won't be able to get along. It's a joke, but it was real.
No, that is real.
We need to find something, because when I'm 50 and 60 and 70, I want to be in hormones.
Right.
And every time I see a 45-year-old patient, 40-year-old patient that some surgeon took out their uterus with their ovaries without any reason, and then they don't give her hormones without any contraindications, I mean, it made me so mad. And that's the beginning. That's where I got interested in learning about hormones. I learned about what bioidentical hormone is. I started reading what is a bioidentical hormone. And then that is how I got really interested and so happy that I found another option.
Right.
So it's like very rewarding now having something for almost everyone.
Yes.
There's something
Absolutely.
for almost every patient.
Well, were you as surprised? I mean, any of you can answer this, but I started learning about hormones, but nobody was teaching about testosterone, and it was a big missing piece. And to be honest, I had a group of patients that found out about this other doctor in my community that was doing these hormone pellets, this testosterone, and they said, Terri, we really love you, but you got to figure this out, because this was a game changer. And then when I learned about testosterone in women, it answered all those unanswered questions of all the women that I wasn't able to help previously. Were you, just with your traditional training, surprised about testosterone in women? Or
Definitely, because it has been a game changer to our practice and to our patients. And most of the symptoms, you can treat them with testosterone. Obviously, estrogen is important, and progesterone also. But only with testosterone, you can fix so many things.
That's right.
Not only what you see and you feel, but what you have in the inside of your body, because people don't think about that when they talk about hormones most of the time.
Right.
They think about the symptoms that they feel.
Right.
But they don't remember that you can increase your risk of hypertension, diabetes, Alzheimer's once you get into menopause.
Absolutely.
So definitely it has been a game changer. And obviously testosterone it's a big deal because it's associated with men. It's not associated with women.
That's what we
think. And then you are like, testosterone?
Yes.
Of course. And when you see the levels are very different.
Right.
And there's a lot of myths like you're going to get facial hair or hoarseness or whatnot.
Right.
I've been using testosterone for 14 years.
Yes.
And I don't have facial hair.
Yeah.
I have a little bit of hoarseness because obviously we all have, our voice changes throughout our life. And if you have certain conditions like reflux, asthma, or something that you have in your GI tract and your tract, you can get hoarseness too. And people don't think about that.
Right.
But when you go to a specialist, they tell you, no, you cannot use hormones. Yeah. And I always ask what they tell you. What were the reasons?
Right.
Because I'm going to get a facial hair and my clit is going to grow.
Right, right.
And then I'm like, see me, watch me. Do I have facial hair?
Same thing. I early on, women are afraid of testosterone because uneducated, misinformed other clinicians will say, oh, it's, you're going to turn into a man. Women don't need testosterone. I mean, that was such a game changer, but it's just so different because, and testosterone for women needs are young, right?
Yes.
I have just even girls in their 20s, they've already had babies. Maybe they're on birth control pills and they're depressed and moody and anxious and all of those things. And the allopathic model, which is what we all learned, is to just treat a symptom with a drug, right? And so, tell me about how have you been able to educate your patients on the difference between treating a root cause with these hormone deficiencies versus the traditional way of, oh, you have anxiety, let me give you Xanax. Oh, you have depression, let me give you Prozac.
At the beginning, the traditional medicine is estrogen, progesterone. So testosterone is a game changer. Like I said, we have a lot of receptors of testosterone all over our body, especially in the brain.
Right.
So, psychiatrics usually get a serotonin enhancer. So estrogen and testosterone are the main of production of testosterone. So if we don't have it, it's going to be depleted. So if we give testosterone, it's going to increase the serotonin level, so we're going to feel better.
Absolutely.
So,
they all work together. Testosterone, serotonin, dopamine even, the calming kind of hormone. So how about you? What are your thoughts on all of this with testosterone in women? And was it a surprise for you when you started learning about it, or did it just make sense?
It definitely was, because it's something you don't learn in traditional med school or even in residency. I don't remember studying even for the boards or anything, with UIN learning about testosterone at all. I mean, as clinicians, we had some levels of testosterone as we do of a lot of other hormones, but not that levels were important in so many things, So, and how the body works and everything has to do with testosterone. Absolutely. Now, having that option for younger women, it's amazing. And like you said, other clinicians, or especially maybe primary doctors, psychiatrists, with those symptoms would treat them with other
drugs, right? To band-aid the symptoms.
Band-aid those symptoms, and because they don't know of any other option. And it's just listening to the patient and now having that option, because you see on their faces, like, I'm frustrated. Right. They do labs. Every clinician says my labs are normal, but I don't feel normal. I don't feel like it was 5 years ago. I don't know. I want to be sleeping all day. I don't feel satisfaction in the activities I used to do before. I don't want to be with my husband.
Right.
I don't want to exercise. I keep doing it because I'm a strong woman and I need to work and I need to exercise, but I don't feel as good doing it as I did before. And then when you check their levels, they're like, in
the bottom, right?
They notice the difference like that. You can give them an antidepressant and they won't feel that much different. They won't have energy.
Right.
Their libido is going to even get
worse, right? Yeah, exactly. Yeah. So, and I always get this question, and you guys have already kind of touched on it about the age. So it seems, obviously women lose testosterone first. And then as they transition into their 40s, maybe progesterone a little bit, and then obviously estrogen. The other, another big myth that, as we're moving out of the testosterone, so obviously we know we've established that women make testosterone, they need testosterone. It's a powerful brain hormone, energy hormone, metabolic hormone, increases metabolism. Libido, of course, is so important. And moods, energy, and libido are the three things that I think impact relationships the most.
Yes.
So I would imagine, like me, you guys have seen massive relationship improvements. So if you have a story or a conversation about that.
Yes, I remember one of because it's fun to work with couples.
Yeah.
And I remember one of our first couples, the day she went to the office for the first time, she didn't have makeup.
Oh.
And then when I saw her,
she had no care about how.
No care at all. I don't even remember her clothing, but I remember her face.
Right.
She was sad.
Yeah.
And then when I saw them at the follow-up visit, she was another person.
Yep.
And that to me was very important and impacting because I knew I was changing her life and their marriage.
Right.
And then they joke because then their kids had to call them Like, where are you at 1 a.m. in the morning? And they're like, we're adults. Why are you calling me and asking me where I am? So it was very funny. And they continue to have pellets with us.
Yeah.
So they have been together as a couple and with us since the beginning. Right. And they tell to everybody, you have to get your pellets. You have to get your pellets because our relationship has changed for the better.
Yeah, and that's the tangible part, right? And the intangible is just all the disease. How about you? Any stories about relationships?
You know, but especially like my own experience is very important because, you know, like at the beginning, like I just get home, my daughter said, Mommy, let's go to eat. I said, oh, orders from food.
Yeah.
I'm just tired. I'm going to get a nap here. So after that, they pellet me, you know, like these 2 weeks after that, I was like, no pain, like more alive, like going everywhere. So after the fact, you know, I'm a person that usually said, you know, like go with the flow, meaning like they ask for a favor. I say, okay, let's go. So, you know, like it's building my self-esteem. So they ask me a favor. I can do that.
And I would imagine that even
like,
yeah, absolutely. Like, I don't have it in me.
Yeah. Like if I want to, I go. If not, I don't need to be, just to follow the rules. So
I imagine, I imagine your patients and your staff probably saw a difference in you, right? Yeah.
And that business asked me, and then I start, like getting myself more, more cute. Like,
yes.
And they asked, I said, listen, I'm just using the pellet. So if you do, I will do it. So that's the first things that start, they see the machine.
Yes.
After
and they trust you.
And I trust the process and I trust the thing. So they trust me. So
great.
There is happy people all over.
And I'm sure you notice when your people in your office need their pellets.
Oh yeah.
Yes. Everybody noticed.
All these women work together and you're like, you need your pellets.
You need to get your pellets. Yes. Somebody starts screaming at the outside, oh, she needs pellets. Swing.
I've said that so many times because I have office staff that answers the phones in our clinic and they always get the patients when they need their pellets and they're not as nice on the phone and they have learned a lot of grace. How about you, Dr. Bonin? Any good stories yet?
Say something similar to that it also not only their partners, it affects their family.
Absolutely.
Children, the people I've worked with, and just opening the conversation. I'm happy that now people they don't feel uncomfortable talking about that, They don't feel ashamed about that. Even in the work, they're like joking about that. I need to get my pellets. And then they notice the people around them notice.
What are you doing? Why are you happy? Are you on, or what are you on? Kind of thing. It's interesting. You just said something that people don't talk about it. And I'm going to move in talking about menopause. But at our event we were at last night, even one of the ladies I was talking to, it was a reporter that was doing an interview. She said, my mother and my grandmother, nobody ever talked about this. And I'm having to figure out this information on my own. I don't know what's happening to my body. It was almost taboo to talk about, so this is why we do things like this, because it really does need to be talked about, because otherwise what happens is, and I know you guys have seen this, women think they're going crazy, literally, and it's very disheartening. You think, I'm only 50, I'm only 45, I'm only 52, 53, whatever. I have another however many years. Is this it? Is this the best I'm going to get? And so much hope. And I think that's what we all love, is giving our patients a hope. Dr. Ashby, I want to talk a little bit as we move into breast cancer. I want all of you, if you have something different to say about this, as we talk about menopause, is the biggest fear for women when it comes to talking about hormones, obviously, is breast cancer. So as a gynecologist and a hormone specialist, how do you mitigate this conversation when that is a fear and a woman comes in, is like, I don't know, I've heard it causes breast cancer. How do you have that conversation?
We just need to educate them, because there are times that they say, why are there two different physicians that I admire?
Yes.
With different opinions. And I just, you have to take the patient slowly.
Right.
And let them know that you know your stuff, what you're doing. Mm-hmm. And explain them the myths about breast cancer with hormones, because there was a study that came out a couple of years ago, 1995, I think it was. Mm-hmm. And that study changed the whole shebang for the hormones.
Women's Health Initiative.
Yes, because everybody then started being cautious with hormones, and that the recommendation was 5 years, the lowest dose needed. Yeah, exactly. And menopause is not going away.
No.
And the symptoms are continuing to be there, and they are getting worse as you age. So you need to get your hormones and explain the patients with data, that they can understand is pretty important.
Absolutely.
And if they want to do it, you do. And most of them come back.
Absolutely.
Most of them
and they trust you. And then they begin, what I found is they begin to feel so much better. It kind of overrides the fear, right?
Yeah.
You said something important about the Women's Health Initiative trial, and this is so important to dispel the myths, because that's the trial that when the results came out in 2002, it started in the late 90s, and the synthetic progestin arm of the trial showed increased breast cancer, increased strokes, increased Alzheimer's disease, increased heart attacks. So we threw all the hormone babies out with the bathwater, right? It was like, everybody, hormones are bad. So in your practice, how do you mitigate these conversations? How do you educate your Dr. Mendez?
Education.
Yes.
Education is the clue. And then, reassuring the patients that for this, I need to do labs. I need to do a mammogram. So
sure,
they're not just so blind to
right.
things. So,
right.
So we insurance that. And then also I talk about the 1960s that when testosterone was used to treat breast disease and all the things.
Absolutely.
And that was very good. But what they don't do it now because, they don't, at the end, they give the same testosterone dose to all the people. So they don't take in account the weight. They don't count the age.
Yeah, bring up.
So, side effects like maybe the myth that growth in hair growth and also the voice, was a concern. So I explained that this is dose related. So we just going to give you the hormones. We're going to follow up the labs. And if they increase, we're going to, for the next peloton,
sure,
going to
change it.
Yeah. It. So they just feel very optimistic about that.
Perfect.
Just explaining that.
Absolutely. Yep. Okay, Dr. Bonin, what do you say? Anything to add to the conversation about breast cancer and hormones?
Yeah, I like telling my patients, explaining to them that not all hormones are created equal.
Yeah.
And it's gossip, when there's maybe much of the studies and WHO came out to just pull off all patients of hormones.
Right.
And they just generalized it. And then all hormones became bad. And now we're getting more educated. There are more studies coming up. So we show them and explain to them the data and the difference between each hormone. For example, I'd like to explain to them, to setting the WHI, the arm or medroxyprogesterone or Provera was used, those patients had an increase in breast cancer. Mm-hmm. But we don't use that one. We don't use medroxyprogesterone. Why use a synthetic hormone and a progestin when you have bioidentical progesterone?
Absolutely.
That is shown to be so beneficial. I even sometimes do them or explain to them this analogy that medroxyprogesterone or Provera is teratogenic. And
yes.
lithium or micronized
exactly
is the one that is used
in pregnancy. Yeah. So one drug can cause. Yeah. Exactly.
Why would you use a synthetic one in a menopausal patient, but in a pregnant patient you would
never use it. Yeah.
Save the pregnancy.
That's an excellent point.
Save the baby.
Yeah.
So make them realize that it is very different. And that we know what we're doing, and this is actually going to be good for it. And they come, as soon as they feel better, they come back.
Absolutely.
They don't care what everybody else is saying, because they even tell their doctors, I don't care, I feel good, I'm the one with the symptoms, I'm going to keep get it.
Absolutely. And basically, what you're saying is the modality matters, right? And oral, whether it's oral or a pellet or a patch, that matters. Whether it's synthetic or bioidentical, that matters. It's so important. And then exactly. And then, I always, tell people, and even listeners that are listening to this, well, why do clinicians and doctors have such differing opinions? It has to do with the level of education, because if you're not following and being up to date on the latest and greatest studies, you'll still be stuck back in 2016 when they said lowest dose for shortest amount of time. Yes. That guideline changed in 2017, but so many clinicians still operate under that guideline, and understanding that even since 2020, the same authors of the WHI that threw the baby out have now come back and said, oh, nope, sorry, estrogen actually protects women against breast cancer. doesn't cause it. So it's a complete flip that we have to continue to educate our patients. So that's so good. I want to move on and talk a little bit about in menopause, the importance of optimizing all your hormones for longevity. So I'll go ahead and start with you and go back this way. When we're talking about longevity, what does that mean to you and what does that mean to your patients?
For them, most people, I have to say, patients think, or when they come in, they're thinking about their symptoms at the moment.
Yeah, that's good.
They're not thinking about prevention that much. And I do like to tell them, because some patients, they feel good. They're like, maybe I don't need hormones. I just went through menopause, but I feel fine. I go through every day. I'm happy. But they need to think about the long term too.
That's a good point.
They link to learn and prevent, vaginal atrophy, cholesterol. You need to protect your brain, your bones. So there's also a reason to get hormones for longevity. And then they realize also maybe, you do need this. It's not only about the present, it's also about the future.
Absolutely.
And prevention.
That's good. And Dr. Mendez, I mean, I would imagine because you were transitioning through menopause, the brain is important to you. I'd imagine you had to have seen a difference in your brain.
Of course, the fogginess, I just went to my refrigerator and they just opened. I just gonna get some juice, and I opened there and they just, what I gonna get? What
am I here for?
Something from the refrigerator. So I went back and the juice. So it's very important, we have receptors in all over our body, especially in the brain.
Right.
So that's gonna help, balance our hormones. Testosterone is very good to prevent fogginess. And also, one thing about longevity that you said is it's not how long we live, it's how good we live.
Yes, quality, absolutely.
So, at the end, I explained everything to them. So I said, just put your body in a balance. What you prefer to do? Just 20 more years, feeling like crappy, like bad, or just 10 years just feeling excellent.
Yeah.
So what do you prefer? So just go for the 10 good years.
Yeah, absolutely.
Because, that testosterone is going to decrease things like Alzheimer. They decrease the beta amyloid deposition. So I have family with Alzheimer. So I start testosterone very early on then, so prevent that thing and help at least my father a lot. So, brain, the cardiovascular disease and all these osteoporosis. Yes. They limit women after the 60 years old or things like that, create, curving and things like that. And then testosterone is just building. It's just not a patch.
Right.
Like Fosamax and all the other things.
All the other drugs,
just
right.
Building of the bones. So, when you explain all the things to people, they just realize that they got to try to take a leap of faith. They got to go for it.
How about you, Dr. Ashby? They've said a lot, but what would you add to that?
I think basically the most important thing is that people think about the quality of life and they don't think what's happening inside their bodies.
Yes, because it hasn't had a symptom yet.
Exactly.
Yeah.
And then they have a stroke or they have a heart attack. Mm-hmm. And obviously they go to their doctor. They're going to give them some pills.
And they're probably going to tell them to go off their hormones.
Yes, and exactly, because the hormones were the cause for those problems.
But we know not
for them, exactly. But what about prevention?
Right.
Because obviously when you get to menopause, there are a lot of things and a lot of changes in your body, and increases the risk for a lot of different conditions, such as cardiovascular disease. So why is that hormones are bad when it increases the risk of cardiovascular disease when you don't have estrogen?
Right.
So why is it bad?
Right. Right. And I love what you're saying about that, because we see in clinical studies that when your estrogen and testosterone are low, you have a higher risk for cardiovascular disease, a higher risk for Alzheimer's disease and strokes, like you said, and obviously osteoporosis and even breast cancer. We've talked a lot about how old and testosterone, and then, moved on to estrogen. We haven't talked too much about progesterone, which is a powerful hormone. But one thing before we wrap up, I don't want to leave the guys out.
Yeah.
You guys are all, you ladies are all gynecologists, but by nature, you surely have been treating some men. And tell me about that for your guys, because a lot of guys think, this is what I've seen. If they have a libido, They don't need testosterone.
Exactly.
Yeah.
They're good.
I'm
So,
okay.
yeah, I'm okay. So what do you say about that, Dr. Bonin?
Exactly. And definitely we see the change in men and they feel great. I always say for a new patient, what I'm telling them about the hormones, they all come back for a different reason is what I see in men. Like maybe some men, they keep coming back because they notice it helps their libido. Some of them, they come back because they notice their pain is just
That's a big one for guys.
they go off their exercise and they feel when their hormones are lower again because they need it because they get their pain back.
Yep.
Other because they don't sleeping well or their mood swings and even their wives and their children, of course.
Notice, yeah.
And everything they notice, their irritability and mood swings. So they all come back for different reasons, I feel like.
Yeah.
But they do feel much better. And I always tell them too about prevention.
Yeah.
This is going to help for heart disease, diabetes, and everything.
Yeah, I love what you're saying about that because what I found, and I used to study men a long time ago, like really with somebody that's a guru of men. But one of the things that I learned from her is what resonates with men is their ability to protect and provide for their families. And when you can speak about prevention and you can speak about preventing diseases that will take you away from your families too early when they need you, that really resonates quite significantly. And Dr. Mendez, you've said a lot, and I love what you're talking about with receptors because it's so true. And there's receptors literally head to toe for testosterone for men and women in the body. Next to thyroid, it has the most receptors in the body for both men and women. But as far as, men go, what are some of the things that you're seeing? Obviously you said joint pain, Dr. Bonin, and testosterone is a powerful anti-inflammatory. Yes. But what are some other things that we haven't already said? Muscle mass. Yeah.
I'm going to the gym and I'm just losing my body mass.
Right.
Also sleeping.
Yes.
If they don't sleep good, they're tired the next day.
And they're cranky.
I'm sleeping better. Concentration.
Yeah.
The same.
That's a big one.
Yeah.
Concentration. How about you?
Yeah, I think most of them they don't think that they feel bad.
Yes.
Because what you said before, because they think about testosterone and the sex
drive, right?
the sex drive.
But when everything's working,
Exactly. For them, everything is working. But then when you start explaining to them, these are the symptoms that you can be feeling right now, like the tiredness. You cannot concentrate. You're not sleeping well. You have mood swings, and they think that only happened to women.
Yes.
And when you start talking to them, and even if they go with their partner, they're like, oh yes, he's moody, or yes, he's not sleeping well. There are a lot of symptoms that they don't get.
How many times have you seen the wife fill out the symptom checklist?
Oh yeah, exactly. And then I think most of them come back because they feel the difference.
Absolutely.
I don't think there's not that much men in our office that don't come back for the treatment because they all notice the difference and how they feel.
And longevity. The last thing I want to touch on, we've talked about all the hormones. And so in pellets, obviously, are your primary. I know you know how to do other things if a patient's not a candidate for pellet therapy. But there's other things that are important to address with hormone therapy. We've obviously gut health is a big passion of mine, but you had mentioned supplements and yesterday when we were talking. So talk a little bit about that, Dr. Bonin, just what's your take on certain supplements that are so important for hormone optimization?
I think that's the important of the holistic approach and doing labs, because if you optimize hormones or just testosterone, but they need thyroid, they're not going to feel as well.
Yep.
I think testosterone and thyroid have a lot of symptoms that they
absolutely overlap. Yeah,
they overlap. So, and you can prevent, treat the hair loss. And so you don't want to treat a patient without supplementing everything that they need with their body. Absolutely. Talking to them about, you need to, everything that has to do with the longevity too, right? You need to eat well. You need to exercise. Let's check your thyroid, your vitamins. At least in Puerto Rico, everyone has a vitamin.
Yeah. Very well.
Has a lot of
and it's so important.
They should get educated about that.
Yes.
It's so important, right?
Right. What are vitamin D levels that you shoot for, Dr. Mendez, in your practice?
Oh, less than 30.
Yeah. What do you want them to get to?
Optimal is more than 60.
Yeah, more than 60.
So, and then vitamin D deficiency is associated with gain weight and also depression.
Depression, yeah.
B12 is another of the vitamins that we offer because it's always with anxiety, and both of them increase the the immune response, like testosterone is just an anti-inflammatory and it's going to increase the immune response, vitamin C. So we just go to the whole approach.
Yeah, the main ones. Anything? What about you? What are your favorite supplements? That do not pass go. They don't leave your office without.
They need to get their DIM.
Yeah,
DIM is super important for obviously for the treatment, but it has a lot of other properties that help our body. The metabolism of estrogen is pretty important. It can help you lose weight. It can help you manage some side effects regarding hormone therapy. So everybody has to take their DIM.
Yeah, DIM. So vitamin D, DIM, those are the key players, obviously, that go along with it. You know, another thing people don't really know about DIM is it's a really powerful anti-inflammatory, and it's also an immunomodulator. It's being used quite a bit as an adjunctive to chemotherapy in breast cancer and in prostate cancer. It just has so many properties. I love that you guys use that. Before we round off, is there anything else? This is going to really go in your community that wasn't said that you want to say? I'll give each of you a chance.
I think the other myth that needs to be clear for patients is the one about stroke or, the coagulation, because that is something else that they hear from other doctors or other people, and they're like, no, I cannot get hormones because I'll get a stroke.
Right.
And that's the easiest one to explain, because it's so proven in studies now that only oral estrogen is going to affect, that risk.
And really primarily oral synthetic estrogen.
Exactly.
Yeah.
So I think that is really important, because then if you take off that concern,
absolutely,
be willing to, and at the end is for them to feel better.
Yeah.
You just want to help them feel better.
Yes. And to avoid something that has such profound life change for a unfound fear.
Exactly.
Yeah. That's really important. What about one thing that we haven't covered that you
want to tell, menopause is not hot flashes. Like people think that I don't have hot flashes, so I don't need a hormone. So you need to be all the symptoms that are present, tiredness, lack of energy, decreased sex drive, all the other things, concentration. So you don't need to pass through this stage, feeling like there is nothing that nobody can offer.
Yeah, that's right.
Have solutions, and you're going to feel much better, and you're going to improve your sexual life. You're going to improve your energy. You're going to improve the way that you live your life.
Yes, yeah. That's so important. So that you don't have to live with it is obviously what you're saying. Any last thoughts of what we hadn't covered you want people to know?
I think very important, more or less for women, that why do you need to suffer with so many symptoms when there's a solution?
Right. An easy solution.
There's an easy solution and a safe solution. Mm-hmm. So encourage people to take their chance, go to our offices or anybody who's doing hormones and get their levels checked.
Yes.
Because probably more or less all the symptoms that they have to be somehow or are connected somehow with hormones, the hormone deficiency. So encourage people that hormones are not bad, that they are here to stay.
Yes.
And hopefully people are going to understand more. And the myths are going to, get in the past.
And the more we have amazing, brilliant doctors like you coming on and educating patients, the better it is in dispelling those myths, misconceptions. And you said something really key that I really want everybody to listen to, is find a hormone specialist. And we would think just out of school being gynecologists, you would be that, but you weren't.
No.
But you are now. And that's really important because a lot of the things that are misinformation is things we're taught. It's confirmation bias. The way we learn it first, it's really hard to unravel that. So I really appreciate each of you guys being here today. I love your island.
Thank you.
Can't wait to be back.
Come back.
Yeah, you guys just are so much fun, and I really appreciate everybody. Thank you so much.
Thank you.